long have you been health director?
Well, I became health director in March of 2006.
Okay.
Before that time, I was a health educator in Tarboro, in Edgecombe County. I have worked there since '93.
Okay.
And then I assumed the health director role in 2006 in March.
Oh, wow. Okay. I remember Mr. Freeman was the health director the first time.
No, Mr. Freeman was the DSS director.
Oh, okay, I'm sorry, DSS
Mr.
director.
Young,
That's
Hugh
right.
Young
That's
was
right.
the health
That's
director.
right.
Yeah.
My first job was a nursing home administrator in Tarboro, and that was like 91, 92,
Oh, wow.
93 or something such as that. So that was my first memories of any of that.
DSS does a lot more with nursing homes than health departments do, unless you have an outbreak in a nursing home.
That's right.
And then that's
right.
when we come in.
Well, that's the first understanding really of the importance of the job. I don't think really folks understand what the health director does. I mean, but you're charged with really taking care of the public health. That may look like rabies. It may look like a COVID outbreak,
or in really anything with communicable disease. We are responsible. It's like when COVID started. I mean, the public health department, if you read communicable disease law, we were responsible for ensuring that we were the law was being followed.
Right.
We followed every case. Every case was reported. This is any communicable disease. So COVID was following communicable disease was not new to the public health department.
No.
Now in this big arena, yes, we weren't ready for that. But all communicable diseases, if you are a resident of Edgecombe County or Nash County, whichever county you're, is reported back to the local health department in which you are a resident. You can be tested for a communicable disease in Burke County.
Sure.
And it's going to be reported back to the county in which you have residence. And so we were responsible for every COVID positive and follow-up to exposures.
Oh, wow. Yeah. So I knew that, I always think more of STDs, right?
Yeah,
because
of course,
that's more of the communicable disease.
Right.
Prior to COVID.
It's the same thing, though. We've had to follow.
It absolutely is, but I think that it's important to make note of that. So.
And foodborne illnesses also.
Sure. Right.
Yeah.
So, well, tell me a little bit about COVID. So, I mean, it feels good. I've gotten both of my shots, and I got to tell you, it's a liberating feeling. I feel like I have been added a layer of protection, but yet, I keep looking at the news. I keep hearing from other sources there may be a reoccurrence or a reemergence of it. So what are you hearing on that front?
Well, in Edgecombe County, we've had over 5,000 positive cases in our county so far, and we've had 107 deaths now. One death is too many.
It is.
We had several outbreaks in nursing homes, and that's where the majority of our deaths came from at that time, but all of them matter.
Sure.
But, and what we're seeing at this time, we follow the CDC guidelines as put forth. They come to us from the state to get that in. And basically what we're hearing now is to be prepared. Right now what the public health department is charged with doing since January is getting vaccine in arms, and we've done a good job. We've probably done about 12,000 so far. Not all of them are Edgecombe County residents because you can't. You have to give it to anybody that wants to come to your health department to get it, and we've done several in other the surrounding area. Yeah. So we've done.
I mean, you're isolated, but you're not isolated. I mean, the world doesn't stop at the county line.
Right. And that's in everything in public health. You can go to any health department, but we're excited that we have hit over 12,000 shots now in our county, and we have also been working together with Freedom Hill, which is an FQHC with OIC, because we couldn't do it all. And now some of the drugstores are getting involved, like Walmart, Thorn Drugs, Bryan Drugs, are all getting involved, Walgreens, to be able to do it. So it's been nice because the first couple of months was kind of tough because it overloaded our phone system. Our phone system would go down, but we were able to, up until the past couple of weeks, we probably did 200, 250 shots a day.
Okay, wow.
Yeah.
Well, that's phenomenal. So, what was it like in the early days? I think a lot of health departments are kind of backed up, trying to get shots out. underestimating what the demand really would be for the vaccine, and so what lessons did you learn from that? Because clearly that's an important thing.
Well, the biggest thing that we had is the shortage of vaccine. We started on January the 5th giving vaccine, and we had enough to get through for 2 days, and that's where we wanted to start, with 2 days to make sure we had our flow right. We have not done a huge mega clinic.
Sure.
We decided to do it 5 days a week, Monday through Friday.
Okay.
And so we have seen, like I said, 12,000 people. But the biggest lesson we've learned is we didn't realize the volume of calls that were coming in. We probably were getting 1,000, 1,500 calls a day, and every phone line we had was backed up. I pulled everybody that I could to answer the phones and check voicemails to get them to the individuals to make the appointments.
Okay.
And it became overwhelming. We probably got 2 weeks behind in appointment making. But luckily we have a partner, Freedom Hill. They helped us with some of our calls, and when they came online to be able to give vaccine, they helped us out and helped us get caught up.
Sure. Well, I mean, Edgecombe County's got 2 population centers, right? Really, Tarboro and Rocky Mount. But it's a very large geographic county with lots of other people in places like Pine Tops and Macclesfield and Leggett, and I'm probably missing a town, so it's going to be upset with me. But
all of them matter. All of them matter.
That's right.
Yeah.
But so logistically, getting shots in arms has got to be a little challenge for you.
Yeah, it really was. It was tough because you have to look at your data to make sure you're hitting your population.
Right.
Initially, it was 75 and older.
Right.
We did a really good job hitting that population, doing it really good. And then you want to look at who you're serving. Are you serving the Hispanic community? Are you serving the Black community, the white community? You want to make sure that everybody's getting the opportunity to be served.
Right, of course. So your 12,000 population Edgecombe was, last time I checked, around 55 or so thousand people. Yeah. So still a little bit of lifting to go. And so, what are you hearing out there? Are folks eager to get the vaccine, or you still have some, pools of folks that still aren't quite sure?
Well, we're still getting calls. We're not getting as many as we were at one time, but we're still getting calls. Right. We have appointments now. You can call us and basically get an appointment in a couple of days, if not the same day if we have one open. So, and that number is 252-641-7511.
Okay.
So you can get an appointment. And also with the other agencies that are listed on our website that you can get an appointment with. Right. So the vaccine is available as long as the state allows us. Now gives us the vaccine. Now we have the Moderna. That's the 2 shots, 28 days apart. So that's what we don't have any Johnson & Johnson yet. I know that Freedom Hill and OIC, I think they have some Johnson & Johnson. We just don't have that at this time.
Well, but I think the efficacy is still supposed to be in the favor of Moderna. So in terms of, call it the robustness of the vaccine, that's still perhaps the brand of choice for the moment. Now,
well, it's like
all subject to change, right?
Yeah, it's like it's 70. No, Moderna is at 60. No,
I thought Moderna was somewhere around 90-something.
96%, and J&J is like 66. The last I said.
Okay, all right.
So. But a lot of people just want that one shot, and I don't blame them.
You know what? The first shot was not a problem. The second one actually kicked my rear end. It did. It was 24 hours, and it wasn't feeling so good. In fact, I made the mistake of getting it the morning before city council meeting, and I'm thinking, oh, this will be fine. Everything I'm hearing, if you have a problem, it's the next day. Well, no, that's not true. It was about 4 or 5 hours, and I was shaking, and I'm like, I just can't make this. I can't make this happen. So
a lot of people have had. Some people have had side effects. Some people say I never felt any different, and some just said they felt like they were just a little tired. So it reacted on people differently.
Sure.
Just like COVID did. Some people would call us, they had no symptoms.
Right.
And they only got a test because their employer or somebody, they were exposed, and they never had a symptom. Some people were sick, some people passed away.
Yeah, well, of course. In fact, my cousin was the first death in Nash County, believe it or not. When the vaccine.
Sorry.
Thank you. But anyway, and my poor son has been in college in quarantine. I don't think I'm exaggerating, 5 times.
Wow.
I mean, to the point I finally looked at him, I said, you might be better off if you've got it, just to have the antibodies, because you're spending so much time in quarantine. I mean, I feel sorry for him. It's sort of a prison of sorts, if you're doing it right.
Well, my oldest son is in college also, and he's been quarantined. Gosh, I lost count.
Yeah, I know. Every time I know, next thing I know, he's showing up at the house, and I'm like, well, I guess he's quarantined, goes to his room. Next thing I know, DoorDash is dropping something off at the door. I'm delivering it to the bottom of the steps. We do that for about 10 days.
That's kind of how we do it.
And then kind of realize, well, he's okay. The last 4 days we cheat a little bit.
Yeah.
And now that I've been vaccinated, and so is Jennifer, it's a lot easier to get to move forward.
Yeah.
So tell me some of the initiatives that you've done to try to connect with like the Hispanic community. I mean, clearly that's English is not necessarily a primary language, so that creates somewhat of a challenge. And that's a fairly significant population in Edgecombe County, and one that's not often talked about.
Well, we're very fortunate at our health department. We have a registered nurse who's bilingual, and an interpreter, and then we have another employee that does appointments that's bilingual. So we are very fortunate to have those individuals, and they are well versed in the Hispanic community. We serve, we have done some vaccine. We also initially, early on, we did the case investigations with several Hispanic families that we had to do. So, and it was really nice to have the bilingual staff to be able to do that. So we were able to follow that up on. We are working with Freedom Hill, who has been takes care of a lot of Hispanics, migrant workers in Edgecombe County. So we are partnering with them and assisting them and helping them serve the Hispanic community. They've already made contact with the farmers in Edgecombe County. They also service Nash County, which is Harvest Health Center out in
out not far from Sandy Cross. It's not Sandy Cross, but out that way.
That way. So it's the same group. It's the same parent company. Is Carolina Family Health Centers. Laura Owens is the executive director there, and we're working with her. She's already got a relationship with the farmers to ensure that we.
So you're just working with existing support groups that exist out there, and just trying to use them as a platform for distribution and communication.
In Edgecombe County, we are very fortunate. Gosh, it's been 5 or 6 years ago. We developed a committee called the Rural Health Network. And in that's what I've got on this paper. In that we have several partners. And then partners, like some of my partners may not be a partner in this, but we all work together. Vidant Edgecombe is the keeper of the employees that work. They're the ones that got the initial grant. Then us, the Edgecombe County Health Department, Edgecombe County Rescue, East Point Human Services, which is the mental health provider, AHEC, area OIC, Carolina Family Health Centers, which for us would be Freedom Hill, Rural Health Group out of Halifax County, and Access East are all parts of this group, and we have kind of coordinated everything together to ensure that I'm not calling the same farmers that Laura's calling. And we've done that with the churches also. Michelle Cherry, who is one of the leaders of this group, she's handling the church initiative for us. So it's really worked. It's really been great to have that resource available.
It becomes more efficient when you're not doubling back and stepping on each other by accident usually. But
it really works good because we coordinate together.
Sure. So what if I find another organization and I say, hey, look, I think I can bring some value to this. How do I connect with you? Do I just reach out and give you a call? Or?
Yeah, they can call me at the health department, 252-641-7531, and I'll connect you with Michelle so that you can be a part of that. It's an awesome group.
Well, clearly it is, and you needed that work not only for this sort of thing, but hurricanes, other disasters, evacuations, and when it happens, you don't have time to be putting together those call lists and those assignments. You just need to react as quickly as you possibly can. So, I mean, that preparedness is awesome, and congratulations on that. Yeah,
that's a big undertaking, and I remember I was working in Edgecombe County when Floyd hit. So I remember having to basically start from the bottom up.
Wow.
But now, you know, when we have a hurricane coming, we're ready probably in less than 30 minutes to be able to deploy to whatever school or shelter that we're going to open.
Sure. So how's the National Guard helped in this process? Have they at all?
Oh, the National Guard has been wonderful.
Good.
We have been fortunate to have about 12 soldiers at our health department. They have not only helped us with entering our data, which has to be entered supposedly at the end of each day. In Edgecombe County, we do have a little issue out in the outlying areas, so we haven't been able to have individuals do their appointment and information over the internet like a lot of counties have. So we've had to put everything in the computer from the bottom up when they arrive, which has been okay. And we've been able to get that done, and the soldiers have helped us do that. They not only have entered that data for us, they've helped us in our clinics with getting individuals registered. They've helped us with making appointments. They've helped us with recovering folks. And we've also had one medic that the last I heard, she had given it, she's done it every day since I think they came the 1st of February.
Yeah.
So she's been there 5 days a week, and she had given about a third of our shots because she's the one that's been there continuously.
Sure, right, I get it.
Her name is Ashley. She's done an awesome job.
Fantastic.
It's been great.
Fantastic. Well, look, clearly some more lifting to do. I mean, you've covered a significant percentage. You're still getting calls. You found other partners to help also distribute the vaccines.
Right.
So what are some of the lessons learned during having gone through this? That you would refine, or that you probably have bolstered up, because it's an evolutionary process, right?
Well, you're right. It's just like when I was talking about with after Hurricane Floyd.
Yeah,
I mean,
I can imagine. Almost
and now, I hope and pray that in my career I never get the pleasure of going through another pandemic. But the thing that I think that has been so valuable to us has been this rural health network and pulling it together. And the other thing that these things sound kind of simple, but when you're in the middle of it, already having these relationships pulled together has been awesome for us.
Sure.
And I can also say, which I did not mention, UNC Nash General, we have a partnership with them. Mr. Isley has been wonderful in working with us. At one time we were running out of vaccine, and he volunteered and was going to give us some. Now, our order came in, we were good to go, and but it's been an awesome relationship. To already have these relationships built is such a value.
One of the things I would say I really applaud you for is not only building those networks, but continuing to talk. So, it's that developing of a relationship that is ongoing, that builds trust, that builds an understanding of what folks are capable of versus not, and really does build a stronger network so that when the time comes and you really need it, you've got it. It's tested, it's tried, it's true, and you're already kind of in play.
Well, one of the things that I think I would be wrong in not saying is I got my start in Nash County Health Department when I first got out of college. So I have a relationship with Bill Hill.
Sure.
And that's been, over the years, that's been so valuable. Him and I talked. We don't talk all the time, but we do talk quite often.
Right.
But that's having that resource together, because we share a lot of the same population. So it's like I've always said, of the 2 hospitals and the 2 health departments, our communicable disease departments, they all know each other well.
One of the things is, I think really when one of the bigger issues has been is the state getting out vaccines. And of course, they're the kind of the clearinghouse, and so it's been coming from Pfizer, from Moderna, and I guess now J&J. So how is that production coming, and how has the state been about keeping those allocations flowing and out? Because that's a big undertaking by itself.
Well, early on in this, back in January, you fought for every dose you could get for your county.
Right.
That was my job as a health director.
How was that allocated? I mean, based on nursing home population, was it demographic? I mean, age?
I don't know. I don't know. They just made a decision up in Raleigh of what we would get.
20 today or 200 this week.
Yeah, I think the most we ever got in January was 700 in a week, and we worked together. We worked with our hospital, with Vidant. They helped us meet the need for that week with the extra that they have. And like I said, Nash General was ready to come forward with some. But the biggest obstacle was to you had plenty of appointments, but not enough vaccine.
Right.
Now, then it kind of equaled out. We did go through, we did use up when the weather got bad out in the Midwest. We did have 4 days with no vaccine, but that was nobody's fault but the weather.
I understand. I mean, and so much of this is no one's fault.
Yeah.
But at least when you had appointments, you could at least manage what the demand was going to be.
Yeah.
And start shopping, if you will.
Yeah.
Calling, I guess, neighboring health departments, say, do you have any extra, and so on and so forth.
And you stayed on the phone with Raleigh, telling them how much you needed. And so was every other health director in the state doing the same thing I was doing. But you just hope you pleaded the best case.
Sure.
And most weeks we got what we needed to get through.
Sure.
For that week.
Well, look,
now, sometimes on Tuesday mornings, the new shipments usually come in on Tuesday mornings. We were like down to maybe 10 or 15 doses, but they got there.
So how do you store them? Because the temperature they're shipped at is like minus, I don't know, double-digit Fahrenheit degrees.
That would be the Pfizer. That would be the Pfizer.
Okay.
We have Moderna.
Okay.
So we store that in our regular refrigerator as we do with all of our vaccine.
I was misunderstanding. I was thinking both of them had these really, really, really cold temps that had to be stored at. But
now, when we were going to have to get some from Nash General, they were more than happy to store it for us until we needed it, and we would go there and get it and use it that way. The biggest obstacle, I think, one of the biggest obstacles that we've had to get over is when you pop a vial, you've got to give 10 shots.
Right.
So if you have 112 people scheduled for that day and 112 people show up, you got 8 to find. So if you see us on the streets in Tarboro begging people to come get a shot, we've not wasted one dose yet.
That is outstanding. That's going to be an outstanding record. I mean, I totally get that. And you don't want to waste it because it's precious stuff.
We all get on the phone and start begging people, have you had your shot? We have a list. Early on, it was not hard to find people to get your shot. But now, because a lot of people have already gotten it, and it's getting harder to find the group. I mean, I think last Friday I was walking down the streets in Tarboro begging people to come get it. We had 3 left over.
Hawking it out. Yes. Come on, I got a shot right now and just need an arm. And it's only good for 5 minutes.
Yeah, that's the thing. You can't put it in the refrigerator like you can some things and use it the next day. That's been tough.
Once you open it, it's just done.
You got 6 hours to get it used.
What can the city of Rocky Mount do to support what you're doing? I mean, I appreciate all that you are doing, and a big part of our resident population does live in Edgecombe County, and I don't really see it in terms of the dividing line as much as we're just one community and happen to reside in 2 geopolitical units. But what can we do to support you and what you're doing? Because you're a big part of our success here in Rocky Mount.
Well, one thing you've already done, when we started this out, we had no idea how our appointment schedules were going to work. Were people going to show up at our door? Were we going to have people, in mob, just people trying to get in? We never had that. We were very fortunate in that people came at their appointment time, but the first thing we did was contact your police department, and they were so helpful and so kind to work with us and just let us know they were a phone call away. And also we knew that our parking area was not huge in our Rocky Mount office, and they were willing to work with us to help us with that. So I do appreciate that. We have called the city hall at times when we had those 1 or 2 doses left, and they sent some folks over to help us out with that. But the thing is, just support us, keep promoting it. Like I said, today you could call. You could have called today at lunch and got appointments this afternoon. We don't have as many appointments as we were having, so promoting it. And I would feel sure that Bill would say the same thing.
No question about that.
To do the same thing, to keep promoting it and helping us get these shots into people's arms that need them.
Right. Well, hopefully we'll be done with this soon enough.
Hopefully.
But I want to thank you for all that you've shared with us today, and I really do appreciate what you're doing, and your team, and your staff, and all that you're doing for Edgecombe County and our area.
One other thing, people have been wonderful. Like today, somebody bought our Rocky Mount staff breakfast. That means so much, and so many people have done things like that over the past couple months, and it has meant so much to staff, and we appreciate that so much.
You betcha. Thank you.
Thank you.
Hi, this is Mayor Sandy Roberson. I'd like to take a moment to thank the sponsors of the Mayor's Brief: Tharrington's Auto Works and Collision Center, Rocky Mount Radiator, and Davenport Auto Park. You know, I am grateful to each of them for their support of this program.